I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it.
The IDD Health Matters podcast is a joint production between Friends for Life and Intellect Ability. For more information, go down into the show notes and click the link where it says Learn More Here.
Hello and welcome to this episode of IDD Health Matters. We're coming to you from the NASDS Conference, the National Association of State Directors of Developmental Disability Services in Portland, Oregon. And our guest today is Bob Sattler. Welcome, Bob.
Thank you, Craig.
So, Bob, I know that you do some phenomenal work in this field in terms of person-centered services, person-centered supports, right?
Yes, you were too kind.
No, not at all. Tell us a little bit about what you do in the field.
So these days, a lot of it is focused on organizational change, really thinking about how to help organizational providers of people receiving services and supports, and state systems to become more person-centered and more effective and efficient and person-centered with their resources.
So everyone out there may not understand fully, even though I've talked about it quite a bit, what person-centered means. What does it mean to be a person-centered organization?
You know, that's a good question, because I think person-centered has become the new buzzword and flavor of the month. Yeah. And if we really are looking at it, it's actually treating people as people.
Simple as that.
Right.
Yeah.
So really thinking about how a lot of times our service delivery system has been focused on keeping people healthy and safe, rather than helping people live the lives that they want and have more autonomy in their lives and more control of their lives. So that's been a big focus of us.
So it sounds like maybe trying to balance what's important for a person to remain healthy and be safe and all of that with things that the person might want to do for themselves, what's important to them.
Right. Things like being happy, being content, satisfied, fulfilled with their lives, having autonomy in their lives, making decisions for their lives.
So does that mean that you should give a person anything that they might want or desire?
No. That is a popular myth about person-centeredness.
Okay.
Reality is nobody gets anything they want in their life.
Oh, well, that's
there's boundaries to everything, whether it's because of the finances we have, whether it's where we live, it's what we are doing with our work. We all have boundaries, and that's no different. So person-centeredness is really within those boundaries, being able to make decisions for your life that help you have positive control over your life.
Okay. So can you give us an example of what that really looks like?
Well, I'm really thinking about, let's say someone is living in a situation where they've got a roommate that they don't like.
Okay.
And traditionally, what we'd probably look at is come up with strategies to help them be compromising about living with that person. If you think about our lives, if we don't like who we live with, we typically decide I'm going to move or I'm going to get another roommate.
Gotcha.
In our system, we may say we're going to help you do that, but then we make people jump through lots of different hoops before that decision actually happens. So it's really thinking about, I don't like it. What can I do to make that change happen?
Okay, that's simple enough. That makes a lot of sense. So you work with an organization. What's the name of the
Support Development Associates?
Support Development Associates.
Yeah. Also, it's a lot easier if you just say SDA.
SDA. That's what I always say.
Right.
There's so many letters in this field. It's so funny though, right? So what does SDA do?
So Support Development Associates is a consulting company that really helps organizations and state systems really think about how you can take this concept of person-centeredness and build it into the organizational fabric and the system, policies and procedures, rules and regulations.
How big of a group is SDA?
We're actually a really small group. There's 5 of us. There's myself, Tanya Richmond, and Michael Small, who are partners of the organization. And then we've got a couple of associates who help us. So we're kind of a niche market.
Okay. But you've got a pretty good reputation in this market, I'll say that.
Thank you. We work hard. We've we have a firm belief that, we're not going to ask you to do anything that we wouldn't do ourselves. So we really want to help people move forward in their lives.
Yeah. And I bet you've touched a lot of people through the years. Have you worked all over the country?
Yeah, I actually started as a provider at Direct Care, actually.
Well, I was going to actually ask you that. So
Yeah.
let's move there. So tell us about how did you get involved in this field to begin with?
Well, I've been in the field for a long time, as I'm realizing each day now. But I actually started when I was 16 years old. I was a camp counselor, and this was back before when people were living in institutional settings. And this camp that I was working at, people from the local institution would come for a week to have fun and get away from the institution. So I really got introduced to people with intellectual and developmental disabilities, and really learned that I could learn much more from them than they could probably learn from me.
That's a good mindset for most of us to have in a lot of different situations.
Yeah. So that kind of diverted my career path. I went into special education when that was a brand new field, and realized that what I was learning in school really wasn't what people needed in real life, because I was actually also working at a group home. And
Did you say you were DSP, a direct support?
I was a direct support professional, and it was back before we had all these rules and regulations. So we could do a lot of fun things, and not that we can't do fun things now, but you got to cross your T's and dot your I's and make everything is checked. But back then, people were moving out of institutions. They were moving into our group home, and they were experiencing life. So we would have parties. I grew up in Massachusetts, so it was when the Celtics were great. So we would have basketball parties. We would have people we were providing supports to come watch us as we were playing softball, and they got to meet all the softball teams. They'd go out after the softball games to really hang out with folks and develop real friendships. And that was pretty exciting.
Yeah.
And it kind of led my career path to realize that I did not want to teach in a school system, because that wasn't helping people get real lives. And so focused on supporting adults. And from there, I moved out to Colorado and helped people back when supported employment was brand new, get people jobs and have them earn money, get out of workshop settings, and then actually ended up starting my own service agency.
Okay.
Because system folks would always tell me, well, you can't do that. You can't make that happen with people. And said, well, let me show you. So I started my own agency, and we really specialized in supporting people who had intellectual disabilities and co-occurring behavioral health or mental health diagnoses.
Sometimes those can be challenging.
People who were challenging to the system, yeah. And they were kind of the outliers. And so traditional models didn't really work. So everything we did was thinking outside the box and listening to what people wanted. And by doing that, amazingly, behaviors decreased, medication decreased, people had better lives, because when you're happy, you tend to take care of yourself more.
Yeah. And you tend to be less frustrated with things, which might sometimes be expressed. Frustration might be expressed in some sort of adverse behavior and so on and so forth. Yeah.
So let's talk instead of throwing that chair across the room to tell me you want to talk.
Mm-hmm.
So that led me, it's been an interesting career path. And what I learned is that we were kind of an outlier, and what we were
meaning as person-centered thinking.
Like listening to people. And this was before SDA. The company I created was called Community Intersections.
Gotcha.
And our whole focus was to bring people and opportunities together. And that led us down some interesting paths. We would get these calls saying, are you a dating agency? I'm like, no, but we have people who want dates. What can you do? Or are you a transportation company? No, but I have people who need to go places. What can you do for me? So it really created a nice network of collaboration.
Yeah.
And then I had the opportunity to work more on a national level with Michael Small, who's the founder of SDA. And that was to help people move out of institutions. So I was traveling around the country helping close institutions. And now we're focusing more on the organizational management stuff, really thinking about how to create person-centered organizations.
So when we look at that, we can say, okay, there's courses you can take to learn about person-centered thinking and learning the basic concepts. And there are certainly concepts and skills that you can learn to be able to support people with intellectual and developmental disabilities. So, but what you're talking about now is a little bit more than just training a few people in the organization. You're talking about transforming an organization as an entity to be this way.
And, when I was a provider, the same philosophy and mindset we had with the people it supported, we would also use with our employees. And, it's really, one of the things about person-centeredness is people say, well, it's just for the people who are using services. And the reality is, if we are not doing this with each other, it's never going to trickle down to the people we support.
That's not the first time someone's mentioned that. And that is a hugely important point that I think sometimes we overlook it. It is huge. It is very important, especially at a time where there's a workforce crisis, to support your employees as an employer, and help foster their growth and help them develop and their skill sets and support them in their own lives.
And when you do that, employees tend to stay.
How about that?
This was before the huge workforce issue we have now, but my turnover rate was about 5%.
Oh my gosh, that's tremendously low in this field. It's usually, prior to pandemic, it was 40, 45, 50%.
Right.
Yeah.
And when you listen to employees and you work with them and support them the way they want to be supported rather than how you think they should be supported, amazing things happen.
So employee-centered thinking.
Well, it's still personal. No matter who we are, we're all people.
Right.
So we have that same philosophy. So I think that's been really helpful. But not only that, we focus on the person because that really is what helps pay our bills.
Sure.
We focus on the employees, and then we focus on the organizational structure.
Okay.
How do you build person-centered practices into your policies, into your procedures, into your day-to-day work? And that is where the transformation really happens. It's not, we don't use, I'm a person-centered organization. This is how I do my business.
Yeah, and it should be just a standard.
Right.
Yeah, not something you have to say that you are.
Right.
And eventually, hopefully we'll get there, right?
I hope so. It's always been, we always hear about pockets of best practice.
Yeah.
And I think I've kind of made it my mission to create pockets of bad practice. So that
explain
all of the person-centeredness becomes the status quo. It's what we do.
I got you.
And then if it's not happening, then it's a pocket of bad practice.
I like that. Okay, that makes sense. You scared me for a little bit. I was like, okay, wait, we're missing something here. Yeah, that makes perfect sense. I like that. Yeah. All right.
So that means a lot of work ahead of us.
And which is perfect lead into the next question is, what's in the future for SDA?
Well, hopefully we will continue the work and we will see the results of the work.
Yeah.
I think what we find with the person-centered organization work, it's a 3-year process typically to really make the change happen for an organization and have it stick.
So it's not something you just take a class once and then all of a sudden everything changes.
No, when we work with an organization or a state system to go through this, we meet with them monthly and review we look at the practices, we look at are there good benchmarks that the organization has identified, are there dashboard indicators to know that you're going in the right direction. So we pull in some quality management techniques, we pull in person-centered skill building, and we work in depth with the organization with their practices. So we'll actually start by doing an assessment of the organization to see how they view themselves from a person-centered standpoint. And then we begin the work and dive deep.
So, there's so much that's happening in terms of the way people are learning now, especially with the pandemic. Things have changed to everything being in person, and now we're doing a lot more virtual training,
right?
And we're also doing electronic learning courses and all of that. And our organization, Intellectability, has had the pleasure and the opportunity to work with SDA and yourself to develop some of these things.
I think that has been a tremendous help, because one of the things from a person-centered organization standpoint, it's pretty intensive. You're not going to get every employee through that. Don't have the time, don't have the resources to do that. The e-learning aspect is really helpful because it gets the foundation out there.
Yeah.
And then if the foundation is out there and everyone's gone through that, the leaders of the organization can focus on building it into the structure so everyone is touched at the same time.
Yeah, it makes it a lot more efficient to reach more people in the organization.
And we're also finding rural areas. It gives people a lot better opportunity to get the training if they're in a rural area.
Yeah. And some other exciting things on the horizon, even some opportunities to create some electronic learning around the organizational shift as well, too. Some courses in there, too. So
Yeah.
it's pretty exciting things that I think we'll be hopefully working on as well.
Yeah, I'm hoping for that too. It'd be really nice to think about how it's applied to the employees.
Yeah.
So
Some good stuff on the horizon for sure.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, "My ability is stronger than my disability." We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escude, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support.
So Bob, one of the things I do on the show is I ask people to give us, I call it 3 and 3. 3 things in 3 minutes that you think, maybe they're tips, they're words of wisdom, they're advice, things that you think can move supports and services for people with intellectual and developmental disabilities, health and wellness, whatever, to a better place.
I think first and foremost, and something I learned early in my career, is that the people whose lives we are impacting, they're the ones we need to be listening to because they know their lives better than we do. And I think a lot of times as service providers and professionals, we know what's best. We know what we know for our life. You know, we look at providing supports to people. And typically when we provide supports the way we want to be supported, which wouldn't work for you.
No.
Wouldn't work for me, vice versa. So we really
There's
need
nothing wrong with them. They're just different.
Right.
Different types of supports.
Right.
Yeah.
And that's what works for you. So we really need to listen to people
I like
from that standpoint. We really need to look at what we're funding. Are we funding what people want, or are we funding boxes that
We're
people
trying
need
to
to
put
fit
people into.
Right.
Yeah, that makes sense.
So, and I know there's often talk about, well, you know, if we do this for you, we're gonna have to do it for everybody. One of the magic things about person-centeredness is other people may not want what you want.
Yeah.
So we really need to shift our thinking about, again, it goes back to listening to people, and that will help design our services. You know, for a long time, there's been a focus on employment. Let's help people get employed and have competitive jobs. Yet we do nothing with the funding structure for the sheltered work that keeps people there. And if we look at it from a funding mechanism, we probably are better off having a lot of people in the same place than spending some money up front when we know it's going to be cost intensive up front, but then it averages out over time. But we haven't made that shift, or we haven't made that decision. So that can be a bit challenging because there's going to be some pushback.
Yeah.
But times change, people change. What people want today isn't what was created 30 years ago.
Right.
And I think thirdly, one of the things we need to look at is how we evaluate quality. A lot of times our quality standards for a long time have been on health and safety.
Mm-hmm.
And when somebody comes in and monitors an agency, it's focused on health and safety. And that is viewed as the ceiling. When in reality,
That should be a
it's the
floor.
floor.
Yeah.
If you can't do health and safety, you shouldn't be providing services. So we really need to be thinking about a ceiling of, is the person satisfied with what they're getting? Is it offered at a quality that is at the level of what the person wants? And that, I think, will start to make the shift for agencies to really look at things differently.
Those are three great points. To the third one, I want to say I'm starting to see some of those changes happen, which is really encouraging, which is great.
Yeah, I think the community settings rule is really helping that.
Yeah. And community settings rule is the final rule that basically says that people should be supported in community settings in a very person-centered way.
Right. People should be treated like people.
That's about, what, how many pages in a sentence?
Exactly.
It's a little more to it than that.
Right.
But
We kind of narrowed it down to 5 things.
Yeah.
I get to decide where I live, who I live with, what I do with my day, how I spend my resources, and I'm going to forget the 5th thing. But those 400 pages.
Yeah,
5
right.
things.
right. And again, it's the balance of those with also ensuring safety and health
Right.
and wellness and all.
Right. It's all about balance.
Yeah.
Yeah.
That is actually a great way to end this. It is all about balance. Life is about balance, balancing things. I tell you what, Bob, I really appreciate you taking the time to talk with me today, sharing your insights and your just the wonderful things that you've contributed to this field. And I really thank you even more for the contributions that you've made and all the work that you do in this field.
You know, I think once it gets in your blood, you're here to stay, you know.
I cannot disagree with you. That's why I'm here. I fell into this field, and it's like, you know what? This is it. This is where I need to be.
Right.
So great to meet a fellow committed person to this field.